Hello, I'm Dr. Jeffrey Niezgoda, and for the past 15 years, I've been the medical director at the Centers for Comprehensive Wound Care and Hyperbaric Oxygen Therapy in Milwaukee, Wisconsin. We operate a very busy clinical practice, seeing wound care patients of all types, both acute and chronic, in the inpatient setting, outpatient setting, and in the home care setting. One of the areas that I have a particular interest in regarding wound care patients is looking at new technologies and determining whether these technologies have efficacy and effectiveness in the management of patients with chronic wounds. I've looked at a number of new technologies. Some of them are excellent. Some of them, quite frankly, we'd rather not look at a second time. However, every once in a while, you come across a product that you're incredibly impressed with, and I'd like to share that product with you today. The product is called Terrasil. And Terrasil is a product that I've had great experience with over the past several months. I've used Terrasil in all types of chronic wound care patients: venous ulcers, arterial ulcers, surgical wounds, diabetic foot ulcers, pressure ulcers, and we've seen very good results across the board. Now, Terrasil is a topical that obtains its effectiveness by providing excellent antimicrobial activity. You know, as a wound care practitioner, that addressing the bioburden and maintaining an environment where we don't have bacteria placing that patient at risk for tissue compromise from an infection standpoint, or the presence of bacteria from a colonization standpoint competing for the host substrates to heal that wound, we provide that patient with a better wound healing environment and get better results. And Terrasil helps us to do that. If you look at the product itself, it's very unique. If you open the top, you'll see that it has sort of a clay appearance. One of the ingredients is a volcanic organic clay, providing the actives to provide the healing. But it comes out of the jar like that. You'd take it on either a fingertip applicator or a cotton tip applicator, and you apply it over the tissues in a very light, thin layer. You don't need a lot of the Terrasil to be effective, but as you cover the wound surface in a thin layer like that, you can see a little bit of this product goes a long way. That's all that's required. It can then be covered with a secondary dressing, and the patient can be discharged to their standard wound care protocol. I have enjoyed working with this product, not only from a clinical effectiveness standpoint, but from a cost efficacy standpoint as well. And if you are looking for a topical that you can incorporate into your wound care practice to really achieve great levels of bioburden control and optimize the wound healing environment, I would encourage you to take a look at Terrasil. This is manufactured and distributed by Aspiera, and we will provide you with the information, contact information for contacting the company to obtain this product. And I would suggest that you take a look at Terrasil, incorporating this into your current wound care algorithms. I think you'll be very pleasantly surprised. Your patients will be very happy that you did so. Thank you so much for taking some time to listen to this exciting new technology, Terrasil.